Watu wanadhani ati ni ugonjwa ya kurogwa. Wengine wanasema kwenyu ni laana uliwachiwa sijui na kuka yako mwenye ulitusi miaka ilipita. But I want to assure them hiyo haina mambo na maybe curse ama nini, ni kitu iko scientifically proven and can be explained and traced kwenye imetoka.
To our 5th episode of the show, and we hope you are getting enlightened as we move on. This week we shall be talking about genotypic tests. Think sickle cell, color blindness, albinism, and more. And I have Mr. Miano with me today. He shall be telling us in detailed form about each condition. Karibu sana.
Asante.
This week we shall be talking about genotypic tests.
Yeah.
So to begin with, what are those?
So these are tests which are used to determine whether your offspring, maybe your offspring can inherit a certain condition from you. Yeah. Remember, you are talking about a couple who want to get married. Yes, and they want to avoid maybe having some trouble later in life.
What are the common conditions that you come across?
So the common condition which maybe we can talk about, or we can advise our viewers to maybe take the test is again is the sickle cell, the Anaemia, and color blindness. Although for color blindness does not have so much impact, because if you are color blind, it cannot maybe change your life in a way. Yes, you will just not be able to see some colors, but you see it's not interfering with your life so much. Yeah.
So I don't know, I think we can just exhaust on the color blindness. When you talk about color blind, what colors is someone not able to see?
Mostly is the green and red colors. Yeah.
So is it that they look one and the same, or how do they look?
The way they explain it, or the way I was maybe told by a friend of mine, an ophthalmologist, is they are unable to identify colors. You might find somebody saying this is green and maybe it's yellow, things like that, or it's white and when it's black. Yeah.
Okay.
And this condition is inherited from the parents. Yeah.
Is there any chromosome that it is related to? It can be...
for the ladies, they have the XX chromosome. I know you understand that one. Now for the men, they have the XY. For the color blind, inakuanga kwa the X chromosome. Aishikangi the Y chromosome.
So ni mimi sasa. It's me who's going to pass the...
not you necessarily, because even the man, if I myself am color blind, it means my X chromosome which I'm having, it has that gene.
So yes.
So if my wife is a carrier of the same condition, now you'll be able to pass it to our children. Yeah. So it depends on whoever is carrying it. But do you know why they say it's more common in men than in ladies?
No.
This is not because for ladies, remember they have two XX chromosome. So if they inherit just one maybe gene from their parent, they become carriers because they have the other X. But for the men, they just have one X and a Y. So if this X is the one which having the gene, then that's a color blind person. Yeah. That's the reason why you hear people saying men are most likely to be color blind than women. Yeah. Even research have shown that most men, those people who are color blind, most of them are men. It's due to that specific theory.
Okay.
Yes.
So then, what do you know what people test for when they're testing for color blindness?
This one they go for multitude test. That one we do not offer here, but if a patient or a client maybe inquire, we usually do referrals to other laboratories. Which we work in collaboration with. Yes.
Okay, so I think we can move on now to sickle cell anemia.
Yes.
Because I think it's common, and I see people talking about their kids having sickle cell anemia.
Yeah.
What is it, and what causes it?
So sickle cell anemia, as the name suggests, itself is an anemia, and anemia is lack of enough blood in your system. So before you reach to the point where you are being defined as having sickle cell anemia, first you maybe explain how we reach to that point. So a person can be a carrier for sickle cell unapata kama ni jamaa, maybe the X and the Y chromosome either can have the gene for sickle cell, hence anaitwa sickle cell trait. Then also for the Rendi anaweza kuwa hata kama kuna X moja yake inaweza kuwa ndio imebeba the gene. Now if the X from the man and the X from the Rendi who are having the both X's they have those gene. Sasa huyo mtoto kama atachukua hizo chromosome kutoka kwa wazazi wake zenye ziko na genes hizo za sickle cell, yeye anakuwa the actual sickle cell person. Hence you will be described as a person with the sickle cell anemia. The parents most likely wanaitangwa sickle cell trait because wao ni carriers tu wako nayo. Maybe one of the chromosome ndio iko na hiyo gene. So that is why it is important juu sickle cell is not a joke, ni kitu imesumbua watu wengi sana, saa ingine it is even fatal, watu wanakufa from it. So as a couple mkienda tu mpimo mwambie kama nyinyi ni carriers, then you get that information, you have a chance of maybe 25% of conceiving a sickle cell person, a person having sickle cell. You know how whether you go and take the risk and maybe pray that your child will not be sickle cell, or you decide maybe to do away with maybe the marriage. That one it's at personal level. You decide yourself. Because even if you have even if you are a sickle cell trait, maybe when conceiving labda itakuwa tu inachukua zile chromosomes zenye aziko na hiyo gene. Hence unapata watoto wako sawa. Yes.
And when we say sickle cell anemia, why the name why sickle cell?
Yes. So now we move to the pathophysiology of the whole thing. So now during the making of the hemoglobin, hemoglobin unajua sasa hapa ndio watu wanakoseanga, mtu akiambiwa damu ni kidogo wanadhani ni the volume of the blood. Is not the volume, ni the hemoglobin level. Sawa ama wenye wanaita hemoglobin level. So
let's start by differentiating the hemoglobin level and the hemoglobin and the blood. Tofauti ni nini?
There is no much difference because sasa blood ni yenye iko na cells zote. Iko na platelets, iko na red blood cells, then iko na white blood cells, and remember white blood cells iko na other types, iko na subtypes, iko na lymphocytes, iko na medullary cells and granulocytes. So for the hemoglobin, hii ni constituent yenye iko ndani ya red blood cells. Sawa. In one red blood cells inakuwa iko na hizo vitu huko ndani. Na sasa kwa hemoglobin moja kuna venye imetengenezwa, kama wewe venye uko saa uko na mikono uko na miguu. So inakuanga na one component inaitangwa the hem, and then iko na hiyo ingine yenye iko na globin ine. Globin ni kama protein, hence the name hemoglobin. Sawa. Sasa sickle cell mahali inatokea, ile gene when the HB is being formed, so umesikia the normal HB inafaa ikuwe na the hem, hiyo yenye ni moja, then ikuwe attached na the 4 globin. So kwa the synthesis at wanasemanga watu wenye wanafanya na DNA kama hizo at position 6, hapo ndio kuna kuanga na interference. A certain protein which is called valine is exchanged with glutamic acid. Hence the HB which will be formed will not be a normal HB. Sawa. Na sio moja, sasa zitakuwa mingi na kadhaa kwa sababu uko na hiyo. Now hiyo hemoglobin itakuwa tu iko sawa kabisa when is oxygenated. Ikienda kwa lungs ipate oxygen, itakuwa tu hata unaona hiyo the red blood cells. Sasa si nimekuelezea the hemoglobin iko ndani ya red blood cells na ndio inashikanga oxygen. Actually ni yenyewe inashika oxygen na ni mingi kwa cell moja. So sikipata oxygen zinasaidia mpaka the red blood cells maintain the shape yake which is by concave shape, na ina move vizuri kwa maybe the vein or the artery. Sasa shida mahali inatokea, imeenda imechukua oxygen hiyo the hemoglobin yenye sasa haikuangi normal. Ya normal person inaitangwa hemoglobin AA, for siku ni hemoglobin SS. So hiyo SS ikienda ikipata oxygen inakuwa tu normal, hata uwezi njua. Then inaenda of course kwa the body system whatever kwenye inapeleka the oxygen kwenye kunatakika na energy na vitu kama hizo. When it becomes deoxygenated, Now due to that effect ina cause the red blood cells to form a sickle shape. Inakaa kama ile mandizi kwa hivyo ama ile sickle inakatanga wheat. Si unaona wheat? Wenye wanakata wheat hiyo ka shape ina form hiyo shape. For one ikiform hiyo shape, movement kwa the vessels itakuwa shinda. Pia mwili inaweza kuwa na a way of removing it na pia itahemorrhage. Sawa sawa. Hence unaona kama cells inafaa kufika ya kawaida kama we mwenye una sickle cell or myself, the lifespan of red blood cells is 120 days. For sickle cells ikianza hiyo tabia unapata inakufa mapema sana, hata 10 days, hata 5 days, vitu kama hizo. And venye inatoka hivyo nilikuambia HB inaendanga HB ndio ukiambiwa damu iko chini ni the level of hemoglobin iko chini. Sawa sawa. So kama the red blood cells zimeharibiwa sana na the system ya mwili juu ya hiyo shape na vitu kama hizo, hence the HB itaenda chini and then you become anemic due to the sickle cell as the main cause. Yes.
And is it curable?
Now at that point when you are being described as a person with a sickle cell, it's hard to treat because you know now this is your body, that is how you are. You have the HBSS and we cannot remove all of it because that means removing maybe all your blood and maybe even if it produces other blood, it will just contain the HBSS. But they just deal with the symptoms and sign. If you become anemic, you are transfused and also you are being advised on maybe taking a balanced diet to improve also on your bone marrow for good production of blood. Because okay, sorry.
No, it's okay.
Yeah, because you know now the blood is produced in the bone marrow, so you need something to supplement and keep the process ongoing. Yes.
So you mentioned about managing symptoms. So I wanted to ask, apart from now the anemic, being anemic, what are the other symptoms of sickle cell?
Sometimes I hear patients complain that it's painful. They get a lot of pain, and I think that one is from the maybe the not so smooth movement of the cells in your veins, so it interferes with the maybe your vessels and the nerves zinaingilia hapo zinafanya mambo yake, then uchungu inatokea.
Okay.
Yeah.
So then
na juu sasa bone marrow itakuwa inatoa damu sana, inaenda inaharibika, inatoa ingine, anaweza kuwa na condition inaitwa osteoporosis.
Weak bones.
Yes. Juu sasa unaona ime overwork.
No, that
at
comes
a later stage. Yes.
Okay. So there's this theory of the people who live in like the western region have higher cases of sickle cell diagnosis than any other region. Is it true?
Yes, research have proven that way, but I don't think there is any interference between sickle cell and climate. Yeah. But
what do they attribute it to?
I think it's just the young genes. They have those genes.
Yeah.
Because research have proven that people from maybe the lake region, that condition is severe. Yeah.
And are there, okay, now you've talked about weak bones as effect of having sickle cell anemia. Are there other conditions that co-occur with sickle cell?
Of course, now when you are sick, generally even your body will experience things like fatigue. Yeah. And also maybe because your body is trying so much maybe to produce other hemoglobin or cells, maybe they can deplete the iron and maybe you can become iron deficient. Yes, although on their cases.
And the myths and misconceptions that are surrounding sickle cell.
Yeah. Watu wanadhani ati ni ugonjwa ya kurogwa. Wengine wanasema kwenye ni laana uliwachiwa sijui na kuka yako mwenye ulitusi miaka ilipita. But I want to assure them hiyo haina mambo na maybe curse ama nini, ni kitu iko scientifically proven and can be explained and traced kwenye imetoka.
Then now we can move to the thalassemia.
Thalassemia.
Yeah. That one. What is that?
Now thalassemia in fact is tumefanya vizuri tunaiongelea after sickle cell. Hii nayo pia unapata kuna ile gene tu yenye nilikuwa nakuambia but hii iko na alpha chain na beta chains. Sasa hizo chain I hope tu tanjaribu tu kushika kidogo
ni
tu.
confused, lakini maybe you'll try to break down.
Nina break down pale kwa DNA unajua kuna kuanga na hizo chains na nini na vitu kama hizo. So pale kwa maybe the partners pia wanakuwa na hizo genes. Hizo genes kama kuna abnormal genes zenye zinaweza cause maybe a produce abnormal HB. Sasa maybe hapo pia wanakuwa carriers kama sickle cell pia tu. So when they pass down to maybe one child, maybe a child can result to be maybe a carrier or even a full blown thalassemia. So tunaweza ongelea huyu mwenye sasa amepata jini zote. Sasa hapo pia kama venye nilikuwa nimesema huko kwa sickle cell, hapa pia kuna mambo ya change in chains na vitu kama hizo. Wanasemanga at position 11 and 16 ni strand za DNA na vitu kama hizo So hiyo ikichange na saa hiyo ndio hemoglobin inatengenezwa. That means whatever you be produced there is not a normal HB. And kama tu sickle cell itakuwa tu na hemolysis na vitu kama hiyo. Lifespan itakuwa low na pia huyo mtu atakuwa tu HB yake iko chini kila wakati.
So like to sum it up in one definition, thalassemia tumesema ni
thalassemia it is a genetic disorder inherited from parents, just like sickle cell. Yes.
Okay. The symptoms?
The symptoms maybe just low HB and unexplained low HB, so that after that maybe the doctor can try and do further test and find out the root cause. Cause hata sickle cell unakunjanga tu unapata mtu damu anaongezewa inaisha sijui nini vitu kama hizo mpaka mufike ile test inaitangwa sickling test. Muone hizo cells zimesiko ndio mjue we are dealing with the sickle cell anemia case. Yes.
Sawa.
Maybe now we have talked about color blindness na hiyo tulisema sio issue kubwa sana. Tumeongea sickle cell, pia tumeongea mambo ya thalassemia. Pia just as more information we can talk about albinism, si ndio? Na kama hiyo tu nyingine tulisema hapo, hii pia ni mambo ya genes na the trait, the gene carrying that trait inakuanga either kwa X or Y. So venye tu nilikuwa nimeelezea kwa sickle cell, maybe you can be a carrier. Let's say maybe I'm married to my wife and my wife yeye ni carrier wa albinism, akona hiyo gene na mimi niko na also wa carrier. Sasa zikishikana huyo mtoto sasa atatoka na shinda ya ana melanin. Mwili itakuwa ina produce melanin. Hence anakuwa an albinic person. Wanaita kwa albinic kama ni albinism.
Someone living with albinism.
Yes.
And because we see that they don't have melanin, what is the consequence of not having melanin?
Unaonanga hata kuona inakuanga shida, juu pia macho yao inakuanga na issues. Alafu pia wanakuwa na kama ukiota njoo unajua utakuwa tu kwa sababu unasikia ni warm yao inasikianga inawachoma choma na unaweza pata pia na akona reddish ya kuchoma na hiyo njua na inflammation ya vitu kama hizo. Cause melanin plays a key role.
Okay.
Yeah.
Sawa.
So I hope those are the main one which we can tackle for this episode. And then just as a way of winding up with our discussion, which was before marriage, it is also good to do maybe mental health assessment. Maybe you can go to your psychologist or a psychiatric doctor. Muassess, muone kama kuna mwenye akona maybe eating disorder. Ndio sasa mkioana mtu akikula sana utakuwa unamuelewa vitu kama hizo. Kuna mwingine akona post traumatic disorder, maybe alikuwa traumatized somewhere. Mambo kama bipolar, autism, schizophrenia na psychotic disorder. Yes.
Okay. I think that's all. I think that's all for this episode. So we can wind up.
Kuna point ya mwisho utatumia ile kamera. Battery yako imekufuatia na lakini hiyo point ya mwisho we can still use this one.
We'll use this one.
So tufanye outro yako na.
We have come to the end of the first section of our show where we've been talking about medical discussions that people who are engaged need to be having before going into marriage. So now in the next segment we're going to be talking about conception, pregnancy, and the whole journey up to delivery. In the meantime, you can leave us questions in the comment sections. We are going to have Mr. Miano come back to the show again. He's going to respond to all those questions as well as cover new topics.